Now we're joined by the CEO of the HSE, Paul Reid. Paul, lots to talk about, and we'll get to those issues in a moment. But can I start with that story in the Mail today? Your reaction to it, how concerned are you by the story?
Good morning, Shane. Well, actually quite similar to your own conversation there with Ciara. From our perspective, there are very clear guidelines which have been circulated very early in this vaccination programme, early January, to all services. There's actually no ambiguity about how backup lists should be identified and prioritised, and we do want them to have backup lists. We don't violate it. But we do expect all services to stick with our prioritisation, our sequencing, who should be in those backup lists. So I'm extremely annoyed, frustrated. I cannot condone. It does impact, it frustrates the public significantly, particularly at a time we're dealing with a virus and a variant that's growing, a lot of frustration in the community about the current levels. And, the vaccination programme is key for us. It's our route out, and it will be our route out, and it's proven extremely beneficial. But matters like this are just beyond frustration, because there's very clear guidelines on
and just finally on this, Paul, just from what you've said there, and I don't want to put words in your mouth, and what you said about the backup list and clear rules, I'm guessing from that, I'm taking from that the explanation that we had to use these, it was either use them or let them go to waste. I'm taking from that doesn't wash with you.
Well, there's two very brief things I'd say. And one, in terms of the vials, certainly has to be used if they're opened. And
no doubt.
That's for the okay, so we all get that. But secondly, once that, and even the preparation for the day does need prioritisation about who you might have on standby for call-up or where you might get the vials to. And there's plenty of options, legitimately around what can be done next. And I don't believe the case of what's happened yesterday can be a legitimate rationale when there's other cohorts that could have been prioritised.
Okay, let's talk about the wider issues. How concerned are you? A minister has been quoted off the record privately in the papers today saying they're really worried about how case numbers are going and the kind of statistics they're hearing back about the number of people turning up for tests. We're wondering or speculating that maybe we could be back at 1,000 cases a day pretty quickly. How worried are you by what you're seeing out there?
Well, I think what we can talk from is experience. And if you think back to early September, when we got to 500 cases, and this would be before even the prevalence of this variant, we quickly went from 500, 600 cases to over 1,000, really quickly, within a week. And we know that with this variant, the transmission levels of it are much stronger again. So it's a cause of concern of the levels that we're at for certain. From a HSE perspective, our cause of concern would be particularly seeing good trends in our hospitalisation numbers coming down, or in our ICU numbers coming down week on week. But that can be a lag effect between rising cases in the community and how we see hospitalisations growing. So from our perspective, if the trajectory was continuing as a very significant upward trend, that would lead in a couple of weeks' time to more hospitalisations. More hospitalisations on the base we're at the moment of 308 people today in hospital will be very concerning for us. So I know it's difficult for everybody, but we can only share the facts and the data, and it is something we have to get in control.
Based on the data you have seen, is it inevitable we will see an increase in cases in the coming days?
Yeah, I think it's very hard to see with the transmission. With what we have seen, for example, with marginal rise in close contacts, a rise in mobility and a rise in people movement between houses, that ultimately has a lag effect on cases growing. But everything we can do now, however, can stop it and can turn it around. So I think people need to have reassurance that what we do now, what we do particularly over Easter weekend, just for everybody to be really careful. We're dealing with high transmission levels, and the more people we move between one household to another, the more the virus grows and loves the opportunity to grow, or anything like play dates or anything like that. It's high risk at the moment with the variant we're dealing with. So we still have a chance to make this not deteriorate to the level where it's deteriorating all across Europe.